friends. It's Kimberly here with Specialty Care Management. Glad you're here today. Today, I'd like to share a little bit about our Oncology Management Program powered by Beacon Advocates. As you may know, Specialty Care Management, we exist to mitigate the risk associated with high-cost catastrophic claims in a holistic manner. Claims like dialysis, air ambulance, out-of-network claims. These are very high sectors or high cost areas in our healthcare industry. Oncology, cancer management, has always been a high spend item, and even more so in a post-COVID environment, as people are now just beginning to get back out into their routine for preventative care and checkups. We are seeing, as we expected, an uptick in advanced stages of cancers. When you're diagnosed with a serious life-threatening disease process like cancer, it's really important to make sure that you have the right support to be able to have a positive outcome. This is one area, along with dialysis, where a specialist in your pocket can make all the difference. Today, I'd like to share a little bit of that difference and what makes our oncology management program unique in the marketplace. Just as you'll find with our chronic kidney disease CKD management program, our nurses, our specialists, also with social services, social workers, our combined talent here has a wealth of experience, over 200 years of experience. This makes a big difference. There are nuances and subtleties and critical components of cancer management that just can't be managed by an app, an email, a platform, and really, truly needs the touch of the expert. Some of those sectors of healthcare, we're not really even, it's hard to quantify. As a matter of fact, I had just read a study, and I was sharing this with a colleague. And I can't remember the name of the study, but I will share it and post it. It was a study done by a group of researchers looking at the role of diet on cholesterol. And these researchers they used a population of rabbits, and they fed these rabbits high fat, high sugar kinds of foods. And as expected, across this population, they did indeed find a dramatic increase in the cholesterol levels of these rabbits. In one subsegment of this population, they found a group of rabbits, excuse me, that while they had a definite increase in cholesterol, their cholesterol rise was 60% less than those of the rest of the rabbits in this cohort. And of course, the researchers scratched their heads for quite a while, wondering how the study was flawed. What was the difference for this group of 60 rabbits? And what eventually came around to was that these 60 rabbits were under the care of the same one researcher in particular. And as they dove further into this, they suspected to see that this researcher might have been feeding the rabbits something different, which they did not find. They found that this researcher fed her rabbits and then that cohort the same exact diet as the other rabbits. The difference was that this researcher cared for her rabbits. She pet them and sang to them, cared for them. And it had obviously a profound impact on the results in terms of what the outcome was for this segment of rabbits. Care, in my opinion, there are two principles that are super important in our industry. And one is integrity and the other is compassion and caring. It's a huge component that I think, well, I'm a tech nerd. I love tech, I love data, but it's really, truly meaningless without that caring component of an expert, somebody who's been there, somebody who knows that landscape and knows what things a member is up against, somebody who knows what the clinical guidelines are, that knows the latest research, that understands the side effects for treatments and medications, and how to help somebody mitigate those, how to help them live a life that they want despite the treatment that might be prescribed. That's super important. And you can't get that with a concierge kind of medical shopper. You can't get that with steerage, although those components are important. Today, I'd like to demonstrate the difference that our program has as I share a story of Al. And I'll share a screen here briefly. Oh, maybe. Al, if I can, I'll make you dizzy for just a minute. Al was a member who had recently undergone colon surgery, and sorry about making you dizzy there. He had recently undergone colon surgery and was basically told by his physician to go home and get his affairs in order. And he had a late, very advanced stage 4 cancer, and that there was nothing that they could do. When he came to us, matter of fact, they had him scheduled to see a specialist for 5 weeks out. And of course, our nurse specialist here was able to get Al an appointment within 1 week. And not only that but to make sure that he was seen by the right physician. And in reviewing his case and the medical records which were obtained, the nurse specialist, the oncology nurse specialist, was able to really compare those with the guidelines and found that really it looked like this member was probably more fitting at a stage 3. And sure enough, the second opinion, which the member did have, confirmed that this was indeed a stage 3. That has huge implications in terms of treatment, and that treatment has a huge implication in terms of outcome. The other things as well, this nurse was able to walk alongside this member and make sure that they had the education and support that they needed to navigate the complex, not only the healthcare landscape, but also to navigate emotional issues and to make sure that that he could, manage the side effects with his treatment. And in so doing, was able to keep him out of the ER. Matter of fact, 2 ER visits were avoided, saving the plan and the member saving $4,000 from that visit, from those 2 visits alone. Also, because the nurse is a specialist and knows what should be billed for, what shouldn't be billed for, was able to correct an error of $23,000 in billing. Helping this member also in terms of financial support, because this member had high out-of-pocket expenses that were crippling for the member. We were able to support him through his treatment, as well as making sure that he had access to community and national financial assistance programs and resources. These kinds of supports not only make a huge difference to the plan, but a huge difference to the member in terms of an outcome. This is really what sets our program apart, in that having the specialist nurse support, the hands-on kind of care that this member will receive, the making sure that we have the right treatment is critical, making sure that we have the right provider, the right physician, that we have the right time. Time is everything. And in many cases, delays can be devastating, and not just for the plan's dollars, but also for the member and their lives as well. If you'd like to know more about what makes our oncology management program unique, we'd love to show it to you. Make it a great day.